Imagine you're living thousands of years ago, and you slip on wet rocks near a river. Your leg bends in a way it shouldn't. The pain is sharp and immediate. You can't walk, you can't hunt, you can't survive alone in the wilderness. So what do? Well, early humans faced this exact situation, and they developed surprisingly effective ways to heal broken bones. Today, we're exploring what our ancestors knew about mending fractures. And honestly, some of their techniques are still used by modern medicine. If you're curious about how humans survived without hospitals or x-rays, I'd really encourage you to subscribe to the channel so you don't miss more fascinating history like this. The story of broken bones reveals something remarkable about human resilience and ingenuity. The first thing early humans did when someone broke a bone was immobilize it. They understood, probably through painful trial and error, that movement made things worse. So they used whatever materials were available. In forests, they'd gather straight branches and pieces of wood. They'd lay these splints alongside the injured arm or leg, then bind everything together, using strips of bark, plant fibers, or even animal sinew. The goal was simple: keep the bone from moving. Archaeological evidence from sites across Europe and Asia shows us these ancient splints. Some are over 5,000 years old, yet they're remarkably similar to techniques we use today. The basic principle hasn't changed. A broken bone heals when it stays still. Movement prevents the bone from knitting back together properly. So splints were a logical solution that early humans discovered. But splints alone weren't always enough. Some fractures needed more support. That's where mud comes in. Early humans discovered that mud, when applied around a broken limb and left to dry, created a hard protective shell. This is essentially the ancestor of the modern plaster cast. They'd mix mud or clay with water, wrap it around the injured area, and let the sun or fire harden it into a rigid case. This technique was particularly useful for leg fractures, where the person needed to bear some weight while healing. The mud cast distributed pressure evenly and prevented the bone ends from shifting. Archaeological digs have uncovered the remains of these early casts, still clinging to bones, giving us clear evidence that this method worked well enough to become standard practice. Now, here's something fascinating. Early humans also used heat as a healing tool. They'd apply warm objects, or even heat from fires near the injury, though they were careful not to burn the skin. We now know that heat increases blood flow to the area, which brings more nutrients and oxygen to support healing. Our ancestors didn't understand the biology, but they observed that warmth seemed to help. They learned through practice what modern medicine has confirmed through science. Herbal remedies played an important role too. Different cultures developed knowledge about which plants reduce swelling and pain. Some used willow bark, which contains compounds similar to aspirin. Others used plantain leaves, which have anti-inflammatory properties. They'd crush these plants and apply them to the skin around the fracture. Or sometimes, they'd create poultices that they'd wrap alongside the splint. The evidence for this comes from both archaeological sites and from studying indigenous peoples who maintained these traditional practices into modern time. Anthropologists observed the same herbal approaches being used for centuries, passed down through generations. This suggests these remedies genuinely worked, or they wouldn't have persisted. Another technique involved elevation. Early humans seemed to understand that keeping an injured limb raised reduced swelling. They'd arrange their patient so the broken arm or leg was positioned higher than the heart. In some cases, they'd use folded hides or plant materials as pillows to maintain this position. Again, modern medicine confirms this works because elevation helps fluid drain from the injury site. Rest was absolutely crucial. Unlike today, where we sometimes need to gently exercise healed injuries, early humans knew that complete immobility was essential in the first weeks after a break. Patients would stay in one place, often near the group's shelter. Others would bring them food and water. This communal support was vital because a person who couldn't move was vulnerable to predators and the elements. The healing timeline was probably similar to today. A simple fracture might take 6 to 8 weeks to heal, while more severe breaks could take months. During this time, the person was essentially dependent on their community. This tells us something important about early human society. Groups that cared for their injured members had better long-term survival rates. Natural selection favored communities with compassion. Some fractures were more serious than others. If a break was severely angled, or if there was obvious bleeding inside the tissues, early humans faced difficult choices. They couldn't perform surgery in any modern sense. In some cases, they'd use sharp stone tools to carefully straighten the bone if it was severely displaced, but this was dangerous. Infection from stone cuts could be fatal, so this was usually a last resort. Infection was actually the biggest threat. Without antibiotics, a wound that became infected could kill someone. Early humans developed practices to minimize this risk. They'd keep wounds as clean as possible using water. they might apply certain plants with natural antimicrobial properties. They understood, at least intuitively, that cleanliness mattered. There's evidence that some fractures actually healed remarkably well. Skeletal remains show bones that broke, healed, and left only faint scarring. These individuals survived and lived normal lives afterward. But some didn't make it. Bone infections, blood clots, or complications from immobility sometimes proved fatal. Medicine has always been uncertain, even when humans do everything right. What strikes me most is how thoughtful these practices were. Early humans didn't have anatomy textbooks or scientific understanding, yet they arrived at solutions that are fundamentally sound. Immobilization prevents movement. Support prevents displacement. Heat increases blood flow. Elevation reduces swelling. Cleanliness prevents infection. These aren't lucky guesses. They're observations from careful attention to what works. If you found this fascinating, please hit the like button. Understanding how our ancestors solved medical problems gives us real appreciation for both their intelligence and our modern advantages. The video covers something truly remarkable about human ingenuity, and your like helps more people discover this kind of history. Specific populations developed regional variations on these basic techniques. In some areas, bone setters became specialists with particular knowledge and status in their communities. They'd travel between groups, using their experience to treat serious fractures. Knowledge about anatomy and treatment methods were carefully preserved and taught to apprentices. When you think about it, early humans invented orthopedic medicine. They created the first splints, the first casts, the first physical rehabilitation concepts. Modern orthopedics builds on these ancient foundations. We have better materials, better imaging, better surgical options, but the basic principle, immobilize the fracture and let nature do the healing, remains unchanged after thousands of years. So here's my question for you. If you had to treat a broken bone with only materials found in nature, what approach would you try first? Would you use splints, mud, herbs, or something else entirely? Drop your answer in the comments below. I read every comment, and I genuinely love to hear what you think. This kind of discussion helps us appreciate human ingenuity across time. And if you haven't subscribed yet, now's a great time to join us. We explore human history and survival in ways that'll change how you see our ancestors. Thanks for watching, and I'll see you in the next video. The first thing early humans did when someone broke a bone was immobilize it. They understood, probably through painful trial and error, that movement made things worse. So they used whatever materials were available. In forests, they'd gather straight branches and pieces of wood. They'd lay these splints alongside the injured arm or leg, then bind everything together using strips of bark, plant fibers, or even animal sinew. The goal was simple: keep the bone from moving. Some fractures needed more support than splints alone provided. Early humans discovered that mud or clay, when applied around a broken limb and left to dry, created a hard protective shell. This is essentially the ancestor of the modern plaster cast. They'd mix mud or clay with water, wrap it around the injured area, and let the sun or fire harden it into a rigid case. This technique was particularly useful for leg fractures, where the person needed to bear some weight while healing.